Hey everyone, I'm Sid and I'm a final year medical student at King's, and today we're going to be talking to Dr. Jude, who is a trauma and orthopedic surgeon currently completing his fellowship in Canada. In this video, Dr. Jude discusses his journey through surgery, the most exciting operation he's ever been in, one myth that he'd like to destroy, and much more. Dr. Jude studied medicine at the University of Manchester and completed his elective at Yale University in America. He completed his postgraduate training in London in the southeast region and developed an interest in the upper limb and trauma. While he isn't in the operating theatre, Dr. Jude runs a fantastic YouTube channel on which he posts videos on what it's like to be a surgeon, study tips, and lifestyle videos. So without further ado, let's go have a chat with him.
How's that?
Yeah, that's perfect.
Cool.
Hi, how's it going?
Yeah, not bad. Not bad. Crazy times, man.
Yeah, it is. How have you been?
You know, it's mad. Stressful time all around. COVID. Work's a bit slow at the moment because obviously a lot of things are cancelled, so we're just kind of slowly building back up. But you know,
Fine. And where in Canada are you?
I'm in Toronto
Oh, fine.
in the 6 with Drake.
Are you still working like full time, or is it just electives? Sorry,
Yeah, it's not. I mean, no one's really working full time at the moment. It's mainly just trauma. We're kind of slowly building up the elective stuff. Maybe doing elective stuff now, really slowly, once a week, maybe.
Okay.
But yeah, pretty much everyone's working like maybe 2 days a week, 3 days a week max, really. All the sports stuff's cancelled, elective stuff's cancelled, so I don't know. We'll see.
Fine. So I just wanted to start by saying thank you so much for joining me. It's a huge honor to have you on this interview. And it's also a real pleasure for me to meet you because I've followed your work on YouTube and on Instagram for a while now.
Yeah?
Yeah, for a while. Yeah, I think I messaged you earlier in the year as well because I was placed at the Pru and I saw that on-call shift video that you did, which was at the Pru.
Yeah, that was just ST7 at the Pru.
So yeah, thank you. And so I just wanted to start by asking you, how did you decide on surgery?
I don't know. You know, I always feel like your specialty picks you. You don't really get to pick it.
Okay.
So, truth is, I didn't enjoy med school at all. The first 2 years, like the non-clinical stuff, which is the exams, I didn't really enjoy it. I was in the football team, and most of my friends were non-medics, and I just enjoyed like going out and stuff. And then in my third year, I was placed on plastics rotation. An SME. I don't know if you guys did them, but they're kind of student selected modules, so you kind of pick everyone does stuff at different things.
Yeah.
And I was just gutted that I was given plastics. I tried everything to get out of it because I didn't know anything about surgery, but I just knew that those guys worked hard and that they had to be in at like 7 a.m. and stuff. And they refused, and they made me do it. And actually, it turned out to absolutely love it. So it's probably year 3, I was hanging out with this plastic surgeon. He was, for the first time, like a actually cool doctor that I'd met, because everyone else were kind of old and white boy club, you know, and it was cool, but we just didn't have that much in common. And then I met this guy. He was obviously in the white boy club, but he was young, suave, probably like 40s. I never forget. He drove a Porsche 911. Patients loved him. He loved the surgeries, and he was just living this really quality life. So that's how I kind of got into it. Followed him, and then I did my elective, and yeah, the rest was history.
Fine. So then how important do you think that elective, I know you did at Yale, right?
Yeah.
How important would you say that was with like shaping your journey as a surgeon?
Well, for me personally, that was pivotal because that's how I found orthopedics, because actually I didn't enjoy orthopedics at med school and I tried everything to not do it. And when I went to Yale, they said you can do plastic, but the plastics rotation is attached to ortho rotation. Yeah. And again, I remember saying to them, oh Lord, I don't want to do ortho. They were like, well, that's how it is. And so I said, cool. So I did plastics, had a great time, and then I did orthopedics, and I had an even better time. And I kind of, in my head, the seeds were sowed. I came back and I did my F1 at Guy's and St. Thomas's, and did my very first job as a doctor was orthopedics.
Oh, wow.
Yeah, and I absolutely loved it. And then from that point on, there was nothing else really that I wanted to do.
That's actually crazy, because twice you try to get out of, first out of plastics and then second out of ortho. Fine.
Yeah, because we get so fixed on what we think we want. That's what I mean by you don't pick your specialty. It kind of picks you.
Fine.
Because I thought I wanted to do plastics. I wanted to be like this other guy I met, and he inspired me and taught me a few things.
Yeah.
But along the way, I found ortho.
And I think I've heard you talk a bit about the difference between the two, because one is about aesthetic and the other one is about function, right?
Yeah, absolutely.
So is that what plays mainly into your desire to choose orthopedics over plastics?
Yeah, I mean, I think for me, like, if I look back all the way even to school, the way my mind thinks, it just fits with a career in orthopedics, because I didn't even do biology at A-level. I did maths and physics instead. And so I always had this kind of problem solving, kind of practical nature about me.
Yeah.
And, you know, you're an orthopedic doctor as well, right?
No, I'm a medical student at King's.
You're a med student.
Yeah.
Okay. So I don't know if you do any orthopedics or you ever get to do it, but it's really all about problem solving, you know? And there's no one way to do things. There'll be an issue. Somebody will come to you, okay, this lady can't walk for whatever reason. And then you have to first of all work out, why can't she walk? Is it? And then I try not to identify, okay, what do we have at our disposal? What can we do to get this lady back walking, or get this person out of pain, or fix his bone and get this person back to basketball or back to work or whatever. So it's all about using kind of scientific principles, surgery, a little bit of art, and then applying it to a specific problem. So that's why I loved it.
Okay, yeah. I can see that. Orthopedics is something I'm actually quite interested in. I'm also, similar to you, I'm also interested in plastics as well at this point in time. But I do see the difference between, you know, function and the aesthetic outcomes. I think you always talk about it, which is that at the end of the day, when you get to see a patient do something that they couldn't do before, it's really rewarding, isn't it?
That's for me personally. But then also, I saw how rewarding plastics can be as well, because I initially thought, like most people, that plastic surgery is like cosmetic surgery, but that is a very small part of what plastic surgeons do. And actually, a lot of plastic surgeons don't do any cosmetic surgery. And actually, the guy I worked for, he may have done some cosmetics privately, but definitely in NHS, we didn't do much cosmetic surgery. But we did do some breast surgery. But even then, the breast surgery that plastic surgeons do often, or kind of on the NHS anyway, is really rewarding. Like, the women are so grateful, because some of these women have real significant psychological issues as a result. Some of them actually have conditions in which it causes, there's conditions where you get absent breast on one side or whatever. Okay. And so a whole manner of issues that he was able to solve by making things look aesthetically more acceptable to kind of social norms, and people are so grateful for it. So you still get the same kind of feeling. Depends what matters to you.
Fine. And so right now you are doing your fellowship in Canada, right? So that's, I think you're now almost 10 years out of medical school then?
More than 10 years, like 11 years. Yeah.
Fine. And in that time, what do you think has been the most challenging part of your journey?
The most challenging part? To be honest with you, I have enjoyed every step of it. It's all been enjoyable because the people that you work with, and also if you get to do what you love where you love it. For me, that was key, because I got to work in London the whole way from F1 all the way to ST8, and for me, it was just enjoyable to be in a community and serving a community of people that are just completely different. You know, people are completely crazy in London. You know, it's never a dull moment. There's and you know, you go from I don't know, there's every demographic. You can't even describe it. And even you got pro athletes. You may even get the odd celebrity. You know, and it's just great to serve such a diverse community. So for me, definitely being in London was key. What was more challenging was probably, I don't know, you know, it's all difficult. When you have to do exams and being a parent and keep up with your training, that's difficult.
Fine.
But by that point, you're kind of used to it. So I don't really know what to tell you.
Yeah, and there are a lot of exams, aren't there?
There are a lot of exams, but you get used to it.
Fine. So I basically posted on Instagram to ask if anybody had any questions for you, and that actually links to something somebody asked, which is, what's your work-life balance like?
My work-life balance at the moment is amazing because I'm hardly working.
Yeah.
But even before all of this COVID, I have to say that your work-life balance, it goes up and down. I have to always tell people this, because you'll have times in your career where you have an objective. And the way I always went about life was never casual, because you can't get away with being casual when you look like me, right? Just to tell you the truth. And I did have times in my career where people would either underestimate me, second guess, and the only way I knew to get around that was to just to be good. And I talk about this in so many videos, but I can't even stress to you how important it is just to be studying, reading, be knowledgeable, show up early. So I kind of went at it with like this aggressive passion and desire to be the best that I could be, not necessarily the best, but the best that I could be, rather than being casual. And what was the original question again?
So the question was, what's your work-life balance like?
Oh yeah, so at that time when I was going through the training and I was trying to be like the best version of myself and reading all the time, it was a bit difficult. You work long hours, and if you're commuting, then you're commuting as well. Most of the time you don't work weekends, and orthopedics, the on-calls really depend on which hospital you're working at. If you're working at a trauma hospital like King's, you're going to be busy and you're going to be sleeping on site, and you're going to be working all the next day even if you were up, so it can be hectic. But then you may be posted at a DGH like Princess Royal, where the on-calls are not too bad, and if you want a good quality of life, then that's a good place to be. And at the moment, I think after you finish training, your work-life balance does get better. Like, you definitely don't work as crazy hours as you did.
Yeah.
And so it's great. I can't complain. Not like it used to be.
And just going back to what you said earlier, I think you've made a video on the things you should be doing if you want to be a surgeon. And I think in that you talk about knowledge is key, and you ought to be reading and staying up to date. So that's sort of like the knowledge side of things. But what do you think? What are sort of the qualities that you think a surgeon needs to have?
The qualities. I think that people often ask about, like clinical ability. Can I be a surgeon if I have shaky hands? That kind of thing. I don't think that has anything to do with whether you're a good surgeon. Okay, so like you could. There's this like age-old saying, you could teach a monkey to do surgery. I don't know if that's true, but the technical side of doing surgery, you could teach that to anybody. With time, that will come. But I think the best surgeons are the ones who are articulate, empathetic, have a high degree of emotional intelligence, because patients will trust you, patients will enjoy seeing you, patients will come back and specifically say, I want to see X, Y, Z, and they'll send people to come and see you, and you just kind of build this rapport with your patients and your colleagues as well. So getting a job isn't necessarily about being the best surgeon or doing the best DHS. It's about being a great colleague, somebody who, has camaraderie, who's enjoyable, positive attitude, somebody we enjoy being around. Obviously, somebody who's intelligent as well and works hard, because you need to pull your weight. Because if we're in a group and you're the elbow guy, and we get an elbow problem, and every time we say, "Oh, dude, do you mind having a look at this?" and they say, "No, I don't look at elbows," or so then you're not really kind of pulling your weight, right? So what people want to see is somebody who works hard, who's committed, but is a nice person, positive, articulate, empathetic.
Okay.
It's challenging, but I think the clinical side of it, that has very little to do with whether you're a great surgeon.
Yeah. So you want sort of an all-round person who's a team player, essentially.
Absolutely, team player.
And my next question is, what do you love the most about surgery, and what do you love the least?
What do I love the most? I actually love being in theatre.
Okay.
Yeah, so I love being in, we call it the OR. So it's weird because I have to keep going back and forth between Canadian terms. But it's just great because the whole day is amazing. You see patients in the morning before surgery, patients you may have known them for like a year. You've known them, you've treated them with physiotherapy, you've treated them with kind of non-invasive techniques. It hasn't worked. They'll come back from it, and then you build them up to surgery. Then you see them in the morning with the family. You're like, right, let's do this. This is the plan. This is what we're going to do. Hopefully, it's going to go well. Family are there. You get into the OR. You sit down with your staff and your team. You tell them, right, guys, this is the plan for the day. For me, I always operate with this bad boy right here. Yeah. So we set the playlist out for the day, and I just have a good time in the OR, and I love obviously I'm an advocate for my patients, I'm an advocate for my staff, and I think now doing that more independent operating is so much more enjoyable. I think I like to create a positive, kind of fun OR experience, so like the nurses usually feel pretty open and able to speak up, because I've seen some surgeons when I was coming up, they would just be mean and they would shout. People don't really want to be in that environment, and when they are, they're quiet. And I've seen surgeons make really bad mistakes, right, or putting on the wrong implant, which should never happen. And I can't help but think, if this person was a nicer person, then perhaps somebody in that room may have seen it and had the confidence to speak up.
Yeah.
But they don't, right? So so I've just always committed my career to making everybody's opinion seem valued. You know, I've cracked jokes with the porters. You know, I don't know who I am. I walk through the canteen. You know, got the dinner lady, and we're good. So for me, I just love the operating and being in theatre. Just try and make it as fun and positive experience as possible. And what do I like least? What do I like least? It's difficult, man. Sometimes I don't actually know. It's a great world, like, especially, you know, you develop really strong bonds with people. So I've got colleagues and friends all over the world, actually. You know, with some cases, what would you do? And then, you know, we discuss issues, such cases, and then we meet up at conferences. And the conference is a great way to keep up with skills, but also a great way to keep up with people and have dinner and drinks and stuff. So it's just a great world to be in. What do I like least? If I'm honest, it would be a UK thing, not so much a thing that I like least. But if I could change two things about surgery in the UK, I would change one, the length of training, and this has opened my eyes from coming abroad. And I've got a lot of friends in the US and in the UK. And some of my colleagues, I was a registrar when they were medical students.
Okay.
You know, some of these guys are like attendings, they're fellows, and I'm doing surgeries. And I was doing this surgery as a registrar when you were a medical student, because we train for so long. They just come out of med school and they do like a 3 to 5 year residency program, and then they're done. So if I was going to change anything, I would change the length of training. Ours is a minimum of 10 years, and I did it in the quickest way possible. Some of my colleagues are still doing it for like 14 years, and that's just ridiculous. And then the other thing I would change, and it's difficult because it's the business model of the healthcare, but it would be nice to see healthcare professionals paid a little bit more.
Yeah, definitely.
It makes a difference, because I work in Canada at the moment, and they're well paid, you know, and to work hard and then be adequately financially remunerated for the sacrifice.
Yeah.
And to see, and I've gone to dinner at my colleagues' houses and met all their families, and it's just great to see them living a good quality of life, nice home, kids live in a nice neighborhood, kids go to good schools. Yeah. That's very difficult in the UK, and it's actually heartbreaking to see doctors and nurses actually quite poor in the UK. So if I could change anything, it would be the length of training and maybe pay healthcare workers a little bit more money.
Yeah, I think those 2 points go really well together, because medical school is 5 or 6 years. Then you got the 2 years as a junior doctor, and then 2 years as a core trainee, and then the 6 more years of specialist training. So
and
by
you
the
still
time
have to go after that, you still have to do 1 to 2 years of fellowship.
So then, yeah. So by the time you're done, it's like 12 years out of medical school.
Minimum.
That's minimum. That's because you did it the fastest way possible as well, without skipping.
Exactly.
Yeah. And I know that you didn't intercalate, right?
Yeah, I did.
So just for students now, would you recommend that they do or don't?
It's completely personal. I think at the time, when I was in medical school, and I didn't go to London Med School, so I think it's maybe more of a thing in London, but outside of London, it was optional. And I opted not to do it because, one, I wanted to get back to London and start my career. I just thought it would be a hindrance. Yeah. 2, I didn't really know at the time what I wanted to do. I didn't really want to have a BSc in neuroscience. It just wouldn't have any value to me. So I wasn't quite sure what to do. And then the other thing is, I just thought that over the course of my career, I think I'd rather do a master's degree at least than a BSc. So I opted not to do an intercalated degree and do a master's later down the line, which is what I did.
Fine.
You do get some points for it though, so it's not a waste. Okay.
So it is a personal decision ultimately, and if somebody thinks it's rewarding, then it's worth it for them.
Yeah, I mean, it's worth it if you're the kind of person who wants to calculate every little point, because now I have actually sat on an interview panel for core surgery, and it's very mathematical. It's not so much at the discretion now of the examiner. Everything is sort of laid out. So obviously, if you've got a BSc, then you'll get points for it. And if somebody doesn't have a BSc, then they won't have points. But you can get an equal amount of points or equivalent amount of points by doing a few audits or something. Which you don't
and I think in your videos you always call it a numbers game, and it is
a numbers game.
Yeah,
absolutely.
Okay. And another question, just going back to what you were talking about earlier, and it's about creating a culture in which people can sort of challenge you as the main surgeon in the theater. And it's really nice that you talk about this, because you do hear a lot of cases where these are like incidents that should have never happened if people, felt that they could talk up to the surgeon. But now to put a positive spin on it, my friend Kanika has asked, what's the most exciting procedure you've been a part of so far?
Exciting procedure? Oh wow, I've done thousands of procedures. The procedure that always stands out in my mind, it was not even an orthopedic procedure. It was a plastic surgery procedure on my elective. But this is when I realized that the possibilities of surgery are just crazy. So it was my first day as well. My first day on my elective at Yale, and they sent me in to see into the OR. First day at OR, met my new boss. They gave me a bleep, give you a locker, and you go in. And so I met this guy called Dr. John Persing. And at the time, I didn't know who he was, but it turns out he was a bigwig in plastic surgery. He was the previous president of the American Association of Plastic Surgeons. And he was dual certified in neurosurgery and plastic surgery.
Wow.
Yeah, and so I didn't even get to read up for this case, but so we had this young girl who had like cranial synostosis. She had a mouse-shaped head. She had, I can't even remember what it's called now, but her eyes were like wide apart, like further apart than they should be. She was a child. She had some congenital issues, and so he was doing like a facial cranial reconstruction.
Oh wow!
And it was my first day, and I'm basically a med student. And so the first thing he did, so he cuts along the face, peel her face down, basically remove her skull, so her brain's exposed, and then he's like reconstructing the skull with plates and stuff, and then putting the skull back together. And I just remember being like, and this took about 16 hours. So I was scrubbed. I broke maybe for about 30 minutes to go have a sandwich, 20, 30 minutes. I remember he said, right, me and the resident, because it was 4 of us in the operation, it's me, a fellow, a resident, and obviously the attending. And so we took it in turn to like go and have like lunch and stuff and I come back. And he just with just pure precision and calm and patience, he was just like reconstructing this young girl's skull and face, and I just was like, wow. That is probably one time in surgery I felt inadequate. I know I was a student, but I just thought to myself, I don't think I could ever do this. Like, I don't know if I could do this. This is crazy. So that's probably the craziest procedure I've been in. Very long procedure. In orthopedics, thankfully, our procedures don't usually last 16 hours, so that was another reason why I jumped ship. Plastic surgery operating times are too long for me.
But he was both neuro and plastic, wasn't he?
Yeah.
That's crazy. So then I just want to ask you, what do you think has been the biggest secret to your success?
No, it's no secret, and I tell everybody this because you're going to find along your career a lot of people who fake it.
Okay.
And that became apparent to me when I started reading. And I realized that I was working with colleagues who were getting away with crap because they knew how to talk, or they'd spend forever building their CV, doing these extra projects or kissing up to certain people. And eventually those people get found out, right? So the advice was given to me very early in my career, very early, and I stuck to it. And I always say it's no secret. It's just to be good, be committed, don't fake it. A lot of people who like the idea of becoming a surgeon, so they become a surgeon, but they don't. It's obvious they don't love it, or they're doing it for some kind of self-gratification. Because if you genuinely love it, you're genuinely interested. You've got cases lined up for tomorrow, and you spend the whole day today reading, and in the morning you're flicking through cases on now you can do it on your iPad, right? But we used to have to sit down and use books, but on your iPad, and you go in and you have an intelligent discussion with your boss, and occasionally things will happen, and he's not sure, and he'll ask you, because the bosses want to know, what have you seen? Because you get to go and work with lots of different people, and they'll say, so what have you seen? Because this might not work. You have you engage in an intelligent discussion with somebody, and all of a sudden your opinion is valued, and your opinion is only valued because it's been clear that you've been committed to this. So my secret is not really a secret. I'm not the most intelligent. I'm not the most academic. I haven't got the most publications or whatever. But my secret really was just to work hard, study hard, and always kind of have this kind of positive attitude. It's infectious. People just like being around you when you're a problem solver.
Yeah, I think it really shows as well. Like especially in your videos, I think you can really see that positive vibe coming through. And, and I really appreciate it, especially when I watch your videos.
Thank you, bro.
No worries. So Sarika Grover sent in the next question, and she has asked, if you could destroy one myth about surgery, what would it be?
One myth. Yeah. I would destroy, well, there's probably two myths I would destroy. One is the myth that surgeons are not very nice people, because they are. And actually, one of the reasons why I fell into surgery is just because I just worked with some really cool people. Really nice, down to earth, fun. Surgeons tend to be type A, which if you're type A, you'll fit in. And they tend to be people who like sports and traveling and maybe doing some weird, crazy stuff, And so if you're a bit like that, then it's just a cool world to be in. So there's some myth that we'll round up, which is just not true. There's a few, but in general, that's not true. And then the other myth would be, they were rich. That actually aggravates me. Now, people don't speak about that, but you go out and everyone assumes you're rich, right? So, it can mess with people psychologically, to overstretch themselves. I've seen people overstretch themselves, and this is something that people won't often discuss with you. People in the UK, for some reason, don't like talking about money, whereas in Canada and the US, a little bit more open about it. So the key to enjoying your life is actually being rich, but people thinking you're poor. That's how you enjoy your life, right? Rather than the other way around, which is often what happens in the UK. The public just assume, and you'll see it, I don't know if you look in the press, they just assume that all these doctors are, going around loaded and, driving Bentleys and, being lazy, which is just not true.
Yeah. So, fine. So those two myths. And I think that plays in nicely to what you said earlier about how medical professionals in the UK especially aren't like remunerated enough, and on top of that, it's quite bad that there's this myth that we are. Definitely. So that's quite frustrating. So I wanted to ask you, if you could be a medical student right now, is there anything you would have done differently to what you did?
If I could be a med student right now, I wouldn't change anything that I did. I think, I talk about money a lot because I think that young people need to be more financially savvy than perhaps the older generation, because the older generation, they weren't rich, but compared to national averages, they were able to buy a house, and the single easiest way to increase your wealth and your economic status is to own your home. And that's becoming increasingly difficult, even for doctors. So what I would say is, if I was a medical student now, I wouldn't change anything that I did inside of medicine, but I probably would have just become alert to, personal financial education a little bit earlier, and then try and get on the property ladder a bit earlier, and maybe be a bit more focused on trying to build up, or at least build up possibility for additional revenue streams down the line. But I think it's important, as you guys now, you finish med school, you're going to have much more debt than we had. And so you just need to be a little bit more savvy than some of the older guys.
I see that in a lot of your videos, you recommend some books about this as well. Do you want to tell us a few titles for this video?
Yeah, so there's a few, like, if you haven't started reading about financial literacy, there's a few mandatory reading books, okay? So the first book everybody should read is Rich Dad Poor Dad.
Yep.
And you may have heard of it. It's an old book, but I think that's the first book you should read on your journey. And then there's The Richest Man in Babylon,
okay,
which is a book which is written for non-finance people, and it basically uses kind of old world kind of parables to tell you key principles about money, about how to save, about how to invest, that kind of thing. And then there's another book called Money by an author called Rob Moore. So those are the first 3 books I recommend every young person read.
Fine, I'll look into those myself, and I'll recommend them on as well. And I want to ask you, what's next for you after your fellowship in Canada?
Yes, well, COVID has kind of destroyed everything. I've been completely open-minded. I came to Canada because I thought it'd be a great city. Toronto's a great city, Canada's a great country. And if there was an option to stay, then it'd be a country that I would definitely be open-minded to staying in. So, we've kind of looked into that. But with COVID, it's extremely challenging. Like, there's a lot of Canadian fellows now who are pulling their hair out because they have no jobs. So I'm going to come back to the UK. Again, the same thing in the UK, there's no jobs advertised at the moment, consultant jobs. Okay. So I'll actually be doing another fellowship at Guy's, which I'm looking forward to, doing a shoulder and elbow fellowship there. And then, hit the jobs market as soon as the world starts to open back up. I need to find a consultant job and start getting grounded.
Fine. When are you gonna start at Guy's?
August.
Okay, fine. I'll still be here. I have my final year at King's, so
okay, cool.
Hopefully I'll see you.
Cool. Yeah, I'll be around.
And my final question is, what's next for your YouTube channel? And somebody's also asked me to ask you, what do you use to edit your videos?
Okay, that's a good question, because I started the YouTube channel after I finished my exams. So we had to do the FRCF, like the kind of the boards, and I had my whole life was consumed by these exams. You studying 24 hours a day, and all of a sudden I had all this time. Yeah. And I'd always make videos anyway, so I said, right, well, let's start a YouTube channel and just teach some of the stuff that I've learned. And so I didn't really know what I wanted to do with it. So I think next, I've just built my website, which will tie into it. It's drjude.net.
Yeah, I'll put a link to that.
Yeah, which is a blog basically, and I'll just share like a lot of the things that we discussed, like the books and the resources and some of the mantras and lessons I learned along the way. I'm just going to drop on there, and that's where I'll also use as a foundation. I'd like to do some more teaching and webinars and that kind of thing, and I'll just use my blog as a way of kind of a foundation for hosting that. And as for the YouTube channel, I think I'll be guided by what people want to see. I think I just want to keep talking about the lifestyle of a surgeon, or coming up as a surgeon, teaching you, things that I've learned, exposing you to things that I'm doing now, like when I was an examiner for the University of Toronto med school exams, or day in the life stuff, like if I've got a trauma list, that's cool, cases, we'll discuss that, getting into medical school, that kind of stuff. Anything, if there's any requests, then I'm always open, and I always tell people to put it in the comments. And then I'll make it, because you don't. Well, when I was a med student, anyway, YouTube was around, but it wasn't really such a big thing, so you didn't really have access. And it's such a great thing, to be able to look into another person's world.
Yeah.
So I'll keep doing that. And as for editing, I use a program called Final Cut Pro.
Okay.
Yeah, it's professional software, but if you're just starting out, then there's lots of free software like iMovie and stuff like that you can use.
Okay. And just going back to what you said, it's really lucky that we have YouTube now, and that we can see sort of like an insight into what future surgeons are doing. I think it's really for me, it's quite inspirational when I get to watch these videos, and I can visualize myself doing that. And I think for a lot of people it must be the case. And I think it also just sort of destroys the creates a level of transparency, and
for sure,
you can see what doctors are actually up to.
I mean, I made the videos more about, initially I wanted to make them more about lifestyle. I didn't really want to talk specifically about surgical cases, talking about, how to pass these exams. Because people are constantly asking me, oh, can you tell us, your reading list for MRCS? But there's so many resources out there for MRCS. So I didn't really want to do it. And because I wanted to enjoy making the videos, I wanted to make it more about when we travel for conferences, we do a discussion about, what that's like traveling to conferences, or what have been some of the challenges along the way, or what's it like juggling work and life, or so more about the lifestyle. So that's kind of what I'm putting out there, 'cause that's what is more difficult to get. But I don't know what you guys find useful.
Yeah, no, I found all of it really useful. So I want to say thank you for this entire interview. Thank you for taking time out to talk to me, and thank you for your YouTube channel, and keep inspiring us.
Thank you, man. Appreciate that.
No worries. Wait, I'll stop the recording now. Thank you so much for watching this video. If you would like to follow Dr. Jude, you can check him out on Instagram at drjude_, or you can check out his YouTube channel, which has some fantastic videos. If you enjoyed this video, please do subscribe and hit the bell icon for notifications. And if you would like to get in contact with me, you can always do so by messaging me on Instagram at @TheWorldWideMedic, and I'm always happy to have a chat. Thanks again for watching. Bye.